Hello, my name is Lisa Barnes from the Rush Alzheimer's Disease Center, and the title of my talk is Association of Self-Reported Discrimination in Older Blacks with Late NC and Cerebrovascular Pathology. I'd like to acknowledge the faculty and staff from the RADC, including my co-authors shown in yellow, the participants, and our funders. Discrimination or unfair treatment based on group identity is an important psychosocial stressor for African Americans and has been linked with numerous adverse mental and physical health outcomes. It's an especially important stress exposure for older Black adults who came of age during the Civil Rights era. Discrimination has been shown to be associated with chronic systemic inflammation, but we are unaware of any studies that have investigated its association with neuropathology. So the aim of this study was to test the hypothesis that experiences of discrimination are associated with neurodegenerative and cerebrovascular pathology in older Black decedents, using data from 3 cohort studies at the Rush Alzheimer's Disease Center. The sample included 76 deceased Black participants who enrolled initially without dementia. And of 347 deaths among Black participants, 157 agreed to autopsy and 79 underwent autopsy. We included all deceased Black participants with available discrimination and neuropathologic data, leaving a sample size of 76. We used the Williams Everyday Discrimination Scale to assess exposure to everyday occurrences of unfair treatment. Example items are shown here. For each item, participants rated the frequency of occurrence using a 4-point Likert scale from never to often. Following previous work with this measure, we recoded the responses to a binary format and summed across items to get a total score that ranged from 0 to 9. TDP43 pathology is the major pathologic protein in FTLD and ALS. It is frequently observed in the brains of older persons with and without AD. We measured TDP43 pathology in 8 brain regions. We also measured hippocampal sclerosis pathology, defined as severe neuronal loss and gliosis in the CA1 and/or subiculum. For this study, we defined clinically significant late NC as TDP43 stage 2 or greater. We measured a number of cerebrovascular pathologies, including cerebral infarcts, large and small vessel disease, and cerebral amyloid angiopathy. We also measured other common age-related pathologies, including Alzheimer's disease pathology and Lewy bodies. We conducted logistic regression models to examine whether self-reported discrimination was associated with late cerebrovascular and other pathologies, adjusting for demographics, vascular risk factors, and depressive symptoms. This slide shows the characteristics of the participants. They were over 80 years at death. The sample was predominantly women, and a little over half had an AD pathologic diagnosis. About 30% had clinically significant late NC. This plot shows the breakdown of the different pathologies for each person. 9 participants had none of the pathologies that we measured. Alzheimer's disease was the most common pathology, but only occurred alone in 10% of the sample. Most people died with multiple pathologies, with a third having a specific combination unique to them. This graph shows the results from separate logistic regression models. As can be seen, higher levels of discrimination were associated with the higher odds of late NC and a higher odds of moderate to severe atherosclerosis. No other cerebrovascular or neurodegenerative pathology was associated with discrimination. Subsequent models with adjustments for vascular risk factors and depressive symptoms showed similar results. In conclusion, higher levels of self-reported experiences of discrimination are associated with late NC and large vessel cerebrovascular disease. These results suggest both a neurodegenerative and vascular neurobiologic footprint of an important race-relevant risk factor for older Black adults. Larger studies with a larger range of discrimination scores are needed to replicate these findings. Thank you.